All right, everybody. I'd like to thank you all for joining us this evening for the DNP Nurse Anesthetist virtual information session here at WVU. I do have a couple of guests with me today, Program Director, Dr. Aaron Ostrowski, and then the Program Assistant, Dr. Mike Fraim, are with us, and I believe they have some students as well, but I'm going to let Dr. Ostrowski introduce them. My name is Philip Engelmeyer, and I am the recruitment specialist. Most of you have had some contact with me, so you can continue to do so if you have any questions in the future, but we'll get to that towards the end. And at this time, I'll go ahead and turn it over to Dr. Ostrowski and let him introduce the students he has with us and continue on with the session.
Thank you, Philip, and welcome to all of you to hear about this DNP Nurse Anesthetist program at West Virginia University. I do want to introduce my students that are present with us. I see Jessica Hughes. Jessica's waving her hand, and I saw Kelsey Boyd. Looks like she's hanging out on her deck. They are enjoying, oh, and there's Carrie Roskowinski. And they are joining us after a rigorous run through the summer courses, and we're happy to have them here. So I'll share a few things about the program, and then we can get to get some input from the students. And if you have any questions from them, they can answer questions themselves. And certainly if you have any questions for us, I plan on talking for about half hour to 45 minutes. And then have questions to follow. So just bear with me while I bring up the PowerPoint to share. And play from start. Okay, so this is the current cohort that we have in our program, and just want to make sure that everybody can see this. Dr. Fraim, is this slide visible? Presentation?
That's great.
Okay. And these are the 15 firsts, the first cohort that we have matriculated into the program. So we are right now 6 semesters into a 10-semester stretch for them. Now they are following a non-traditional progression plan. The traditional progression plan is going to be 9 semesters, but just due to the unique accreditation timeline that we had, these students are doing the program over 10 semesters. So they are 60% of the way through. So they are over halfway, and they'll share some perspectives later on. In overview, the program is a Doctor of Nursing practice program. You're probably familiar, if you've been looking at different programs, that there are DNAP and DNP programs out there. Because this program is housed in a School of Nursing as the conducting institution, our degree is a nursing degree. So Doctor of Nursing Practice, DNP, will be the degree that you would earn through this program. It is 88 credits in length, and it is a full-time curriculum, meaning that the credit loads that you take each semester make you eligible for full-time student status. And it is a hybrid curriculum, which I'll touch on in a couple slides. 2,000 clinical hours is the requirement that this program is required to provide for students, and that is established by the Council on Accreditation of Nurse Anesthesia Educational Programs, or the COA. And that is the entity that is accredited the program, and we were accredited effective October 9th, 2019 for a 5-year period, which is a normal initial accreditation period of time. And our maximum cohort will be 15 students every year. Introducing the faculty, Mr. Engelmeyer touched on who I am. I'm Aaron Ostrowski. I'm the program director, and I've been in practice as a CRNA for 19 years. I got my master's in the science of nursing degree from the University of Pittsburgh in 2001, and I practiced in UPMC Presbyterian in Oakland near the Pitt campus for 15 years, and been in sRNA education for 12 years in the Pitt program, and then came to WVU in 2017 to set up the program that we have here today that we're talking about. And then Philip introduced Dr. Mike Fraim. He is the assistant program director, and I'll just let Dr. Fraim say a few words about himself.
Hello, everyone. I am a Marshall grad. I got my BSN at Marshall, spent 3 years in critical care, and then went to return to Marshall and CAMC's program and did my master's in science and healthcare administration, and then knew I wanted to teach. So I came back and got my DNP, which is a doctorate of management practice degree. That's no longer available. Now you either get a DNP or a DNAP, and our program does boast a DNP, which is wonderful. I spent the first couple of years of my career in a hospital in Elkins and got some really good experience in regional anesthesia, then spent a little bit over a decade in independent rural CRNA practice, and it was just me and a surgeon. And now I'm back at CAMC at a Women's and Children's Hospital and specializing in pediatrics. That's my niche, what I like to do. So I was a faculty member at CAMC's program for about 2 years, and very much enthusiastically joined Dr. Ostrowski in 2 Julys ago, and very happy to be here. And it's a pleasure and to be at WVU. The resources are amazing. Our human resources, the stuff we get to use in SimLab, and then of course our clinical sites have been fabulous. So excited to be here. I'm glad you guys are all on this Zoom meeting, and hope if you have any questions, you'll just reach out to us.
Thanks, Dr. Fraim. And in addition to Dr. Fraim, who is the one person that I've met in my career that works as hard, if not harder than I do. He puts me to shame sometimes. So he has been a tremendous asset to the program. So I'm so glad he's here. Now we've added just recently, Dr. Kellen Smith. He is a CRNA who works out of the Cumberland area at Potomac Valley Hospital. And he's been in practice for 8 years. And this is his first venture into sRNA education. So we will mentor him. He's guest lectured at a couple of our courses already and has done an excellent job. So we are happy to hire him effective July 1st. So we're excited to have him. Brenda Dean is our administrative associate. So come time for interviews and some other communications, you may hear from Miss Brenda Dean. So I wanted to introduce her. Now, talking about the curriculum specifically, as I mentioned, it is a hybrid curriculum. So that means a mix of online and face-to-face classes. But in terms of what the anesthesia piece of the program would be face-to-face, but there are 30 credits of online core DNP courses. And these courses prepare you in the basic nursing type sciences, and also prepares you with some other courses in advanced pathophysiology and pharmacology that we'll touch on before you get into the anesthesia pathophysiology and anesthesia pharmacology courses. And then there are 36 credits of face-to-face nurse anesthesia courses. And we'll talk about some of those specifics as we look at the progression plan in a couple slides. There are 15 credits of clinical practicum courses that, with the credit hours, there's a ratio of basically 150 hours per credit, clinical credit that you get. So if you kind of do that math, it'll equal out to about 2,100 hours. And I'll show you how that's mapped out through the progression plan for clinical practicum. And then there are 7 credits of DNP Project courses where we budget time for you and your faculty of record, your mentor that guides you through from faculty through the DNP Project process. I'll talk a little bit about the DNP Project as well. So looking at the core DNP courses, the red boxed areas include the core DNP courses on this slide. You see the advanced pathophysiology course in the first semester of year 1 that I mentioned already. There is a course in health research statistics, and then scientific underpinnings of the DNP role. In the second semester, advanced pharmacotherapeutics, advanced lifespan assessment, and evidence-based practice methods. These initial 6 courses serve as foundations in pathophys and pharmacology to get you ready for the anesthesia portion of the curriculum. And you are required to have, per the Council on Accreditation of Nurse Anesthesia Programs, so many credit hours of pathophysiology, so many credit hours of pharmacology, and so on. So these courses help to meet that requirement. The statistics course, the EBP methods course, prepare the student for getting into the DNP Project courses, which start in the 3rd semester. Population health promotion, you see transforming healthcare through information technology, healthcare leadership, and healthcare issues, ethics, and policy help to round out the advanced practice nursing requirements that are kind of wrapped up in what's called the DNP essentials that help our students to meet what is required of the advanced practice nurse graduate at the graduate level. These red box courses include all of the anesthesia courses in the curriculum. So starting in the first semester, we discuss with you some professional standards and structure of the profession of nurse anesthesia. We introduce you to the professional association, kind of get your brain thinking of the way a nurse anesthetist does about the profession, and talk through that. In genetics, chemistry, and physics, we start to delve into the sciences and discuss some concepts that you may have heard in high school and hopefully in a college class, and get you refreshed on those. The next courses include Foundations of Anesthesia 1, which discuss basic principles of anesthesia in a 2-part course structure. So basic Principles 1 will set you up to learn what you need to initiate a basic anesthetic. And that lecture course is paired with a lab course, Foundations of Anesthesia Lab, that walks you as the student through a structured workshop and simulation progression that prepares you for clinical entry towards the end of the summer semester. So just to let you know, and you can see in the parentheses at the top along the summer, spring, and fall, spring, and summer blocks there, fall and spring semesters are 15 weeks each, and summer is 12. So we do compress a lot of things into those semesters, but you do go year-round for 3 full years, so 36 months. Moving on to the year 2. Foundations of Anesthesia 2 is a course in which you learn regional anesthesia. So how to put in a spinal, how to put in an epidural, how to do some basic nerve blocks. And we also discuss common anesthetics that you encounter in specialties such as orthopedics, some abdominal surgeries, and other common surgeries that you'll encounter in the first couple rotations of your clinical life. Advanced Anatomy, Physiology, and Patho is divided into 2 courses through the first semester of year 2 and the second semester of year 2. we discuss cardiac, pulmonary, and central nervous system physiology and pathophysiology in that course, and then move on to the hepatic, renal, and other systems such as endocrine, hematology, etc. in the second patho course. Our students have that fresh on their minds as we speak. The advanced pharm course in the first semester of year 2 picks up where the other pharmacology course left off. We take a deep dive into the drugs of anesthesia and teach you how to use them. Then moving on into the spring of the next semester, there is nursing 747, perioperative assessment and care. That is a course in which you learn ultrasound use, how to do point of care ultrasound examination of blood vessels and locating different nerves for, say, blocks and such. And then advanced principles of anesthesia is a 3-part course where the physiology and whatnot that we learned of the cardiac and nervous system in the prior semester gets applied into how to manage cases in cardiothoracic, vascular, and neuroanesthesia in the following semester. And then we have a couple more advanced principles courses in the semesters that follow. Management across the lifespan discusses pediatrics, obstetrics, geriatrics in a kind of lifespan format. That's the idea there. And then advanced principles 3 in the first semester of year 3. Management of special populations includes taking care of the transplant population, trauma, pain management, and others. So then in addition to the advanced principles course in that semester, there's a professional issues course, which picks up where nursing 740A in the very first semester of discussing professionalism, we kind of now take a deeper exploration of professional issues in nurse anesthesia and kind of prepare you as a now senior student with the perspective that you've developed over your couple years of clinical experience by this time, you know, how your thoughts have developed, and kind of prepare you for life after school in a professional environment. One thing that is I found missing in my graduate education in nurse anesthesia was a course that discussed the business of anesthesia, management and finance. And you will take on a career here that will give you a good standard of living. And we do want to prepare you on how to handle that upon graduation, and not to be misguided. So we want to take that piece and give it to you. Then we conclude the anesthesia curriculum with an evidence-based anesthesia review in the final semester. And honestly, the whole final year is designed to be kind of a review of what we've looked at in anesthesia thus far, and to start preparing you for graduation and taking the certification exam following school. We've done nothing for you if we haven't prepared you to be certified post graduation. So the evidence-based anesthesia review will kind of culminate that year, and we will give you a series of reviews of concepts and do some frequent testing throughout that semester to prepare you for the rigor of the certification exam to follow graduation. So I took some time with that, but I wanted to talk through that to make sure that you understood the flow of the courses. Now, this DNP project is integrated into the curriculum, but it can be somewhat of a parallel process because it doesn't always exactly integrate with what you're doing in the nurse anesthesia courses. So it's somewhat of a parallel process to the specialty courses in clinical training. Projects are frequently in the realm of quality improvement, though there can be some other elements such as policy analysis and so on that could qualify as DNP projects, but you will work with faculty to work on ideas that could be developed into a DNP project, and we will help you with that. But basically, the objectives of the project include assessing the practice environment, determining any kind of variances or differences from national benchmarks that you might find in a clinical situation. It could be at a clinical site that you visit as a student. It could be from the ICU that you've just left, and can confer some goodwill onto that ICU and help them fix something that maybe your manager has wanted to work on for years but just didn't have the time. This is what a DNP project can do, and benefit from a student to a former ICU, for instance. We have a couple of those in our class. Refine and address that practice problem, and we walk you through this in a stepwise fashion. And it's done by critically appraising the existing literature, see what exists about the current problem that you're looking at, and what would be an evidence-based way to best address that problem. Then you can design an initiative to address that, and seek approval from the school and from, of course, the host institution where you want to implement this project. And the idea is to have some type of organizational change occur. Can something that you sensed as a problem be addressed, and implement some kind of change in that system? And once that implementation is done, data is collected on it, and the evaluation of the outcomes is done. And then finally, you as the student would write up a manuscript that is done in a structured way that we have established for you. It's called Squire Guidelines, and you ultimately present the outcomes to your stakeholders. That would include, of course, your faculty, but even more importantly, the clinical site that you were working with to implement the change. So this is another Redbox slide showing you where we have DNP project development throughout the course. So in the initial course, there's after taking the evidence-based practice course and the statistics course, you are ready to take the DNP project development course, which helps you and your faculty of record develop the idea of the project and come away from the course with a pretty good draft of a proposal for your project. Then in subsequent semesters, you see Nursing 831 DNP project implementation over several semesters. A minimum requirement for graduation from our program is 7 credits of DNP project work. So we have 2 credits for project development. There are 2 credits for project presentation. And so 3 credits of project implementation are planned into the program for you to have time to implement and collect data on your project, which, depending on the scale of your project, could take 2 to 3 semesters. And just in setting up the program, I was advised to budget a little extra time for that. And so we look to get the project done really in the first, couple years plus, give or take a semester. And we are on track with several of our students to get done with their projects with a year left in the program, which is really a win, because getting the project done earlier gives the student time to pile on hours of clinical time and to start preparing for boards for certification after graduation. The clinical commitment is at a minimum, according to the COA, 2,000 hours and acquiring 600 cases of experience prior to graduation. Now, in our current 2022 class, this cohort will graduate in December of 2022. They have acquired 767 hours and an average of 265 cases each. So that's for the average for each student. And so they are approaching about 40% of their totals they need in both categories. I think the hours are just under 40%. I think the cases are just over 40%. We have 15 clinical sites in West Virginia, Maryland, Ohio, and Pennsylvania. And there might be some concerns about licensure. At this point, there is a compact between West Virginia and Maryland that's in effect. I'm happy to report that Pennsylvania has finally come out of the Stone Age, perhaps, and has joined the compact, but that I think takes some time to be effective. It might take effect in 2023. Ohio is not part of the nurse compact, so to go to any Ohio site that we have, which is just one at this point, Marietta, Ohio, requires a license to be acquired. So this is just a map representing the spread of our clinical sites. So if Morgantown is centered here, we have along the 79 corridor, UHC in Bridgeport, Stonewall Jackson in Weston, West Virginia, and further south, Somersville, and then Raleigh General and Beckley. We have 2 clinical sites in Huntington, West Virginia, which is about 4 hours roughly from Morgantown. And then near Parkersburg and across the Ohio River in Marietta, Ohio, we have 2 clinical sites at that location. Then Garrett Regional Medical Center near Deep Creek Lake. Cumberland, Maryland is UPMC Western Maryland. And then in the Eastern Panhandle near Martinsburg, Berkeley Medical Center, and just south of that in Ranson, West Virginia, Jefferson Medical Center. Our lone Pennsylvania site is Conemaugh Medical Center. Now, we have a mix of models of how anesthesia is practiced, and you might think of nurse anesthetists working independently. You might be familiar with nurse anesthetists working with anesthesiologists, and we have that spectrum of care that we have access to in our clinical sites. So as you could imagine, the academic medical center, Ruby, WVU Medicine, Ruby Memorial Hospital in Morgantown is the anesthesia care team model. So you'll work with an anesthesiologist in those cases, along with a, co-assigned with a CRNA. But we have places like Garrett Regional Medical Center, Somersville in Somersville, West Virginia, and Stonewall Jackson. And we might be able to acquire another 1 or 2 sites here in the near future that are CRNA only. And so you get an idea of what it's like to be an independent practitioner as a student. The clinical practicum hours are spread throughout the latter 2/3 of the curriculum. We do start clinical practicum in the 3rd semester after preparation with the DNP courses, kind of getting them accomplished, the base courses out of the way first. Then we start into the anesthesia piece in the heavy duty in the latter 2 years. Clinical practicum starts in the 3rd semester with just kind of dipping your toe in the world of anesthesia. In the clinical practicum, we prepare you with the clinical entry through that Foundations of Anesthesia lab course, do a mock induction at the end of that lab course to prepare you for clinical entry the following week. And you do about 4 weeks of clinical, which would be about 60 hours. And then we start with the clinical practicum series from Foundations Clinical Practicum 2 to Advanced Clinical Practicum 1, 2, and 3, and then a clinical immersion in the final 2 semesters. And really, it just speaks to increasing the number of hours. Basically, the first semester is 2 days a week of clinical practicum, and then subsequent semesters are 300 hours per semester. In red is what you see that represents the hours. The red numbers are the hours that you need to acquire per semester, and they build as you go through the program. In the final 2 semesters, 450 hours would equate to about 4 days per week. And that's what the students will build into as they get more to a more senior level. In terms of the preparation, we have lots of simulation in the curriculum. As we've gone through our courses, the number of hours that we've spent in simulation has actually increased from the estimates that I had initially. So if you look at our different courses, Nursing 743, Foundations of Anesthesia Lab, those are kind of piecemeal workshops from the anesthesia workspace preparation to assessment, to basic airway management, monitoring and positioning, vascular access, and gas machine, kind of build you for the final mock induction, mock anesthetic induction workshop simulation that has you prepare a patient from the start of a case to getting them asleep, placing a breathing tube, and then taking care of a simple complication that is common after anesthesia inductions. And we prepare you to go into clinical with that knowledge. The regional anesthesia workshop is kind of self-explanatory, but that's where we teach you the spinals and epidurals and some basic nerve block techniques in that workshop. And then perioperative assessment and care is in the blue block. That's the course that our students just completed, and they learned the ultrasound and central venous cannulation piece. We did an advanced airway workshop, learning how to manipulate a fiber optic bronchoscope to intubate a patient or to check placement of a double lumen endobronchial tube. And if you don't know what that is, you've never seen one in the ICU unless some patient has come back from thoracic surgery with that. I'd be interested to hear if anyone's ever seen a double lumen tube, because I never had seen one prior to anesthesia. Advanced principle simulation is actually what we just completed yesterday. We completed simulations that addressed cardiac surgery, neuroanesthesia problems, and vascular emergencies such as emergency AAAs in a simulation environment, and the anesthetic implications that are required to be addressed in those cases. Pediatric simulation will be a simulation that comes up in the following semesters, as well as a difficult airway workshop and a trauma and pain management workshop and simulation. So our total hours of simulation throughout the program are now estimated to be about 64. I was around 57 in prior presentations, but we found that we've used the simulator and workshops more often than we thought. So it's working out well. Simulation is a great tool for learning, and I just wonder if there's any comment from the students thus far that are currently in the program, on anything that I've talked about thus far. What's kind of struck you as, oh, I forgot about that, or whatnot. I'm going to stop sharing for the moment. Maybe Jess or Kelsey or Carrie could speak up.
I know in nursing school, when we did simulations, I was really apprehensive. But I have to say the simulations have been really, really helpful. I in my former life did a lot of proning patients and I felt really confident with it. But I have to say, like, when you're managing the airway and when you're doing it and when you're calling the shots, like, we did a positioning workshop that I think was beyond great. I think it helped us realize that, wow, it makes sense why they put the blood pressure upside down. Like, I always used to admit my patients to be like, why does anesthesia do this? Why are the lines like this? And it just really helped to realize, like, oh, you have to think a different way. So I really enjoy simulation, actually. And we have a really great simulator. So.
Kelsey or Jess?
Yeah, so
Go ahead.
it's crazy to think back now, but just even going through a machine check, and as basic as that is, to do that before you go to clinical, I mean, I'm just reminiscing at this point, like, well, it's crazy to think how far we've come since last year, essentially at this time. Is that about last year that we were doing those? Getting ready to, huh?
It actually hasn't even been a full year yet.
Yeah.
I mean, it is amazing. And you guys were sitting around thinking about it just yesterday, as we're kind of debriefing our simulations for the day, from what you guys were able to do or not able to do as you entered last year into the first clinical course. And now look at you, you're talking anesthesia language, you're taking care of complex cases and knocking it out of the park. So they're doing terrific. Kelsey, anything to add?
I think just listening to the DNP Project talk, it can be easy to get like very overwhelmed with that whole concept and process, but to look back on that of where it started and where we are now with it, it really wasn't so bad looking back at it. And the whole process, every step of it helps you in a different aspect of this program, like writing the papers and doing the research and all of those things. It really does help you overall with other things. So don't hear about it and think about that project and get overwhelmed, oh gosh, we have to do this DNP project. It's not so bad.
Talk a little bit about your project, Kelsey. I'll ask the others too, just to share a blurb, an elevator speech about their project.
So the hardest part about the project is choosing what you're going to do and what somebody is going to let you do. Once you get that established, the process from there is easy. I mean, not easy, but it's much better. So my project is on pre-op diabetes education. In my population for the project was total joint surgical patients. So we were educating total joint patients about their diabetes, trying to see if that changed their pre-op blood glucose level. So I'm in the process now of looking at my results and getting that all figured out and comparing groups of diabetes versus the patients who did not have diabetes, to see if just a simple intervention of providing some education of how their blood sugar could affect their overall surgery and results, if that was beneficial. So that's what I was doing for my project.
Thanks, Kelsey. Jess, how about your project?
So mine's stress management and resiliency training. It's also called SMART training. It was developed by a physician out of the, not Cleveland, the Mayo Clinic. He's done TED Talks and all kinds of stuff and published multiple papers on this specific training. He recently developed an all online version of it. So through reaching out to him, I was able to get access for 20 participants that are current neuro ICU nurses that were able to take the online program. And then I found some already existent tools to measure resiliency, stress management, and burnout. So it's kind of addressing the whole burnout aspect. I also chose to do it as an online course versus face-to-face, just because I was developing this all during COVID. So I didn't want that to be the reason I have a giant hitch in my project. And then it being online, it kind of made it a little bit more fluid in that regard. But it is a lot of work up front. But the way that breaking down the proposal, it's every other week, I think it was, like a different section of the paper was due. So you weren't writing this like big, beefy paper all in one sitting. You were kind of doing it over an entire semester. So it was really helpful. In the moment, you're like, oh my gosh, I'm never going to stop writing. But in the grand scheme of things, like it really does break it down into manageable pieces. And then at the end, you pretty much have like 2 small sections to write before you submit it to the review committee to get your approval to continue on with your project.
Carrie?
I have to agree. I really like the way that this program set up in the aspect of that we do our DNP project, we get it out of the way, and then we have our really core anesthesia classes closer to boards. So some programs are set up where you're right into anesthesia, and that's great, but then you have like this year of DNP, and then you have boards, where I feel like it's more fresh in our mind. And also Kelsey said, I think the biggest limitation of this project is who are you going to find and what are they going to let you do? I took a travel assignment up to New York, New Jersey when all COVID hit, and what we ended up doing turned into my DNP project. We ended up putting our names and roles on scrub caps in the back of our PPE because no one knew each other. And I found out that working in an OR, no one knows each other, especially if you work in a really big operating room. You know, you're going to walk in day one and no one's going to know your name as a student. So what I did was I put my name and my role on a scrub cap, and there's a lot of people that recognize me. Oh, you're the student. Oh, you're Carrie. And they've read that name on my scrub cap. So that kind of turned into my DNP project. And I was supposed to do it in a simulation lab. And then, you know, with COVID, you just kind of roll with the punches. And I ended up doing it in an operating room, which worked out great because it was real life information. It wasn't even a simulation. So I think everything worked out great.
And Carrie, you're planning on moving into the last phase of starting to write a manuscript this fall. Kelsey and Jess are progressing well with their data collection and will probably be on track for the spring of 22. And so that's really what we wanted to accomplish with the DNP project, was to start it early and often, and get it a good proposal started so that the project design and whatnot could be kind of handled and out of the way. And really implementation is kind of a low maintenance phase. I think there'll be some work on the back end here to write the manuscript, but with a well-designed and executed project, it should fall into place. So that's the plan. All right, well, thanks for sharing all that, guys and gals, and I'll continue back to the presentation here. So I just wanted to share a couple pics of our simulation lab in action. This is Carrie right here in our first semester on the left side, talking to our patient. And this is Dr. Fraim, is her faculty in the room. Notice the AirPod in Dr. Fraim's left ear. I'm talking to him through a little walkie-talkie app that we have through our phones, and I can give him guidance on the scenario and how to guide Carrie through any kind of difficulties that she might encounter, and just to guide the scenario in general. On the right side is Megan Gillespie. She's one of our SRNAs, and she's learning femoral ultrasound guided venous and arterial line insertion. So that's a central line kit that she has in front of her. And we take this course called Teleflex through Teleflex that supplies central lines to WVU medicine, and get a certification through that course. This is just a couple of pictures of our groups. We've had a couple of workshops, of course, through this semester. This is from this summer, and we wanted to capture people without our masks on for the first time in a while, and it was nice to all be vaccinated and able to enjoy our full faces. And then Kelsey in this top photo is modeling our West Virginia nurse anesthesia, and Jamie has in this photo as well a t-shirt. Kelsey was spearheaded the development of our own West Virginia nurse anesthesia merch. So she led that charge and got us some fresh looking apparel to wear around the school. So time commitment, this is probably the biggest thing to talk about. How much time is this going to take for my life if I take on this program? So if you look at the clinical time, which is a minimum of 2,000 hours over 6+ semesters, That's roughly equivalent to a half of an FTE, or a half-time job. Clinical preparation is going to take 1 to 2 hours a night. Class time is calculated at 1 clock hour per credit hour per week. And if you're taking 8 to 12 hours of credits per semester, that's 8 to 12 hours per week, depending on the semester. That could be another quarter of an FTE. So really, class time is a minimal part of this curriculum. It's the reading, writing, and study time outside of class that really chews up a lot of your time, 3 clock hours per credit hour per week. And coupling that with clinical time, class time, and the reading and studying and such, that could equate to nearly 2 full-time jobs worth of time out of your week. So you have to really consider that. While I cannot restrict any employment arrangements that you might want to have, the possibility there that you need to consider not working throughout this program. And I'd welcome some comments from our current students about that, about the time commitment.
You are not going to have much time. No, you have to find the balance, but it is very, you look at this on paper and you're like, okay, yeah, I can do that. That's manageable. And then you start living in it. It's like, oh, wow, this is like a lot. But that's not to scare anyone. It's just to be very realistic and upfront. Like, this is like a full time, like, life commitment that you're making.
And I think with anything, like if you needed or you wanted to pick up a shift, I could go pick up a shift, but all that means is that you are going to be taking time away from studying or time away from preparing from clinical. It's all like a give and take. So to go and pick up a shift, you're going to be taking time away from somewhere else that you need to be spending your time. You're going to be investing a lot of money into going to this program. So you would really just be doing yourself a disservice if you did pick up a shift or try to work when you could be using it other places.
And I would say I'm kind of a workaholic, where I worked probably at least part-time for the first year of this program. And I have to say, there was no way last semester I couldn't even picked up a 4-hour shift. There is just no way. I mean, when I was writing papers and stuff, maybe, but not when it comes to the study time. There's nope, impossible.
Yeah, I would share that even personally. I'm the program director, and really anybody that's a program director in a nurse anesthesia program has some element of mental illness and a bent towards self punishment or something, because this was hands down the hardest I've worked over a 3-month stretch of my entire life. And the students can probably acknowledge that there are some days I looked pretty tired. But to that end, we will be adding faculty and other resources to the program as we continue to grow. As we have added Dr. Smith, we are interviewing other faculty as we speak, and there are many people out there excited about this program. But kind of the approach that Dr. Fraim and I have taken is that we want to set up each of these courses as we had planned and see them through one full run. And then we will start turning them over to other faculty. So, and one thing I realized I forgot to include in this, and you guys have touched on it in your student discussions, there is the cost. Now I will bring that up here before we get done. It's not part of this presentation, but I'll bring that up. Admissions criteria include being eligible for admission to West Virginia, meaning the university. So there is a requirement to meet minimum graduate school requirements for the university itself. And then there are School of Nursing requirements that include BSN from a nationally accredited nursing program, a minimum of a 3.0 GPA on a 4.0 scale, and completion of 3 credits of undergraduate statistics and 3 credits of health assessment that should appear on your transcript. And yes, there are different titles and names and languages that different schools use to achieve the same course statistics and the same course health assessment that we would call. So there are equivalencies, and we take a look we take a look at your transcripts to determine those. You just forward them to us. A GRE is still required from within the past 5 years, though I will say for the coming year that we are exploring getting rid of the GRE requirements in the coming year, but that is not in any way finalized yet. At this point, the GRE is required for this program. We require no minimum score. Just taking this the test at this point is all we require. Critical care experience is an absolute must for at least 1 year. Preferably 2 to 3 years is what we've found to be a sweet spot for someone who has elected to go right through undergrad into critical care and into a career nurse anesthesia. Needs a couple years, 2 to 3 years of experience to become seasoned and kind of develop that instinct to understand when a patient is not doing well, can have some resources and know and be a resource to others in their unit. That's the type of candidate that we're looking for in our interviews and in our profiles. Letters of recommendation, there are 3 of them that need to be filled out. So hopefully you can find 3 people that can write a decent recommendation for you and actually follow through and submit it through our portal. And that's sometimes can be challenging. And then writing an essay, we have a guided writing rubric that we ask you to adhere to. If you just adhere to those questions and details on that writing rubric, on that prompt, you'll be fine. If your profile for the application passes muster, we will ask you to come and interview with us, and then we'll let you know. We can let you know in a timeline that I'll share here in follow-up for admissions. And you also need to have be eligible for unrestricted licensure as a registered nurse in West Virginia. The admissions process, we open admissions annually every August 1st. So as of today, the applications for the fall 23 cohort will open August, or have been open. I'm sorry, that's for the fall 22 entry. And applications will close on November 1st. Applications are screened for completion. We'll call you to schedule an interview. The interviews occur in January typically. And the structure of them is just to have a round robin interview with a candidate meeting a pair of faculty. Usually we've had 3 pairs of faculty, and we'll also include a student opportunity to talk with current students. And we've also given some thought to possibly including maybe having a spouse or significant other of a current student to meet with candidates to give you a real idea of what life is like, not just for the student, but for the significant other as well. We'll tour you around the School of Nursing and the Health Sciences Center, show you the steps, simulation center, and during the interview process, and then do decisions, pass along decisions in February. Now, of course, COVID did change our plans for having candidates come in and interview in person. We did interviews via Zoom in the last admissions process, and I think it worked out fairly well. And I could see implementing that is part of a core interview process, and then having, on-site opportunities to come and tour, as desired. That's yet to be determined. So we'll communicate that as we move forward. So that's really all. This is actually a policy that's for clinical sites. We make sure that you're supervised by a CRNA or an anesthesiologist in your clinical sites, and that you're only really supervised by no more than one CRNA per 2 students in a particular clinical site. And we do protect your rights as a student, that similar to HIPAA and health information, we do protect your rights as a student with respect to your academic record and clinical performance. So at this point, I'll stop sharing and take any questions. I will take a look at, if someone else starts answering a question, I'll look for the file on my computer that shares you the cost. And I can share you the cost of the program. But basically, I can tell you that an in-state resident of West Virginia is going to cost about $120,000 with tuition and fees, and an out-of-state student is going to pay about $192,000 for tuition and fees. That's, but I can show you the breakdown of that. So with that, are there any questions?
I actually do have a question.
Sure.
I wish I could say I was a little bit closer to the application process and getting an interview, but I actually had a couple interviews today. One's for SICU, and then the other one is for the new children's hospital for the pediatric ED. And I know that you do take for critical care as long as it's a level 1 trauma center. Do you have any comment on, would that continue over in Cary with the pediatric department at Ruby?
I guess I'm trying to understand exactly your question. You're wondering whether the experience in the pediatric ICU would count?
Not the pediatric ICU, at the new children's hospital, the pediatric ED.
Oh, I see.
You want me
Yeah,
to
so
speak to that?
emergency department experience does not count as critical care.
And
Yeah.
Autumn, I'll just interject. I had an ER background when I went to anesthesia school back in the day, and it wasn't required then. But I will tell you that in my own personal experience, I got up to speed, but I had a bit of a learning curve that you don't want to have to worry about. I mean, when you start anesthesia school, the water's already running fast, and you want to be able to join right in. I had to the thing is, you may do an A-line or a central line or start leave a fed or something critical, intubate and put them on a vent in ER. But and the students that are on the call, they might attest to this even, because they have closer remembrance of that. But in the ER, you don't get that long-term critical thinking and evaluation and troubleshooting. It's more, oh my gosh, it's a crisis and we handle it, but we don't look at labs again, and we don't see like you would in surgery, where we're constantly assessing and changing and tweaking. So that's really why ER experience has fallen on the wayside. They actually have looked at numbers, and ER only applicants that become students don't pass their boards as readily as somebody that came from a ICU background. So that's really why they changed that.
Thanks, Dr. Fraim, for clarifying that. Any other questions? This is your time.
Dr. Ostrowski, I just went ahead and put a link in to the chat. Our application is open. So some of you may have begun the application process already. The application is open. So I just provided a link that kind of goes over some of the program requirements. as well as some steps on how to be able to complete the application. So if you guys are welcome to refer back to that. Most of you should have my contact information as well. So I'm happy to send you that email as well if you need it.
And I did find a file that I can share real quick, just with the estimate of costs. So can everybody see this PDF? The let's see, so tuition for resident for 9 semesters. So, estimated tuition for 9 semesters, and you see resident on the left, non-resident on the right. You can see just tuition alone costs $103,000 and versus $177,000 for a non-resident. And then the fees accumulate about $16,000 of additional cost, and the fees are kind of spread out there in detail in the little table above. So we do have a laptop program where we require all of our students to buy typically an Apple MacBook, and they typically a MacBook Air, and that is standardizes the computer across all students, enables the same performance, and we do testing through the laptop. We do, of course, assignments and all that stuff are done on the same software packages, so it's consistent across all of our student cohort. Then we do have you join the AANA as a student, and student membership costs $200 for the duration of the program. Apex is an anesthesia learning software platform that can help with review of concepts and summarize them for you, and enhance board preparation upon graduation. Typhon is a clinical tracking tool that allows us to look at your clinical hours and your clinical cases. PreCheck is a way for the school to handle credentialing needs of the students to go to clinical sites. And the SEE is a self-evaluation examination that students take to in this like second to third year transition, to see how they're doing thus far in the program. My Clinical Exchange is an entity that communicates with clinical sites to allow onboarding to occur easily. Licensure is the nursing licensure. It has to be done annually for West Virginia, so it costs about $200 throughout the program. BLS, ACLS, and PALS has to be accomplished every couple of years. We estimate that cost at about $300 per renewal. And understand that applicants should come in with BLS and ACLS and ideally PALS certification already established. We would hope to have a regular renewal for students to occur in the just prior to entering clinical, and then to have a renewal about 2 years later to kind of prepare you for graduation. So we hope to include that as part of a program oriented renewal service, and it could potentially reduce the cost of those certifications that can be acquired elsewhere. Books, this is a variable cost. We do have a vast majority of our books available through the Health Sciences Center online library, and you may not need to purchase as many books as you think. And students can chime in on that. Health insurance is, if you don't have your own source of health insurance, you can buy it through the university. Costs about $1,000 per semester for that premium. So that's estimated there. And then a lab fee of $150 every semester is added on for our experience in the workshops, simulation labs, and so on. So that costs about $13.50 per student, or $1,350 per student. My apologies. So that's, I wanted to make sure I shared those costs with you just to be forthright and let you know what's going on there. So any final questions for anyone?
I had a question.
Yeah,
You said the GRE scores, there's no minimal scores. I know looking into other programs, I know you went to Pitt, so I'm sure you know this, but they won't really look at your application unless you're in the 50th percentile.
right.
How weighted is the GRE scores when you guys are looking at the applications?
How weighted? You know, less than 5%. It might even be 2% or less of the score. I mean, it's minuscule compared to, you know, really our biggest factor is looking at GPA. GPA is the piece that you've demonstrated over your academic career, what your pattern of study and achievement is. Whereas the GRE reflects, you know, whether you weren't feeling well, perhaps on the day that you took the test. And frankly, it's been shown not to be very, you know, helpful in determining, you know, nursing intuition and you know, academic achievement.
Thank you.
Yeah. Anyone else?
I had a question as well. So I am starting next spring to finish with my bachelor's. So could I apply? It wouldn't be until fall of 2022 for hoping to start fall of 2023. Can you still apply saying when I would start school? You know what I mean? I'd be done with my bachelor's. I'd be done with my 2 years of ICU experience or so on.
So you're just wondering about timelines?
Yeah, like, could you still apply if you would have, you know what I mean? Like my bachelor's will be done in December of 2022, but not, you know, if the cutoff is November, like I'd still have another month left.
Right. So as long as you have the time, you know, have the degree in time for the enrollment, you know, that would be okay.
Okay.
You would have to have that time. So if you're like working on your BSN at the time of the interview, as long as you'd be done before, you know, the classes would start, that'd be okay. And you
Okay.
could be, you know, acquiring your ICU experience along the way.
Okay.
And you get credited with the ICU experience at the time of interview. We assume that you're going to be working in the ICU up to the time of enrollment. So we basically add, you know, a half to 3/4 of a year onto your ICU experience based on you know, the time that you interview.
Okay. Thank you.
Yep. Anyone else?
One more question.
Sure.
I'm sorry. So I worked at Presby for 5.5 years. Recently in October with COVID, I started traveling, taking up crisis assignments. Since then, is that still okay considering it's critical care experience, or do you guys look for more of the staffed? I mean, I still work casual at a UPMC facility right now in the ICU. I just didn't know how that looked in regards to traveling versus having a staffed job back here.
If you're traveling doing ICU care, that's fine.
Okay, perfect.
Yep.
Thank you.
Yep.
It has been my experience. It's not a reason to start to be a traveler, but travelers get the worst assignments, sickest patients. So in some ways, our strongest students sometimes have been travelers. But that's not
plus you learn flexibility and, you know, going to different places and different systems and, you know, adaptability. So, you know, there's definitely pluses to that.
Yep.
Any final comments from our current students? Any words of wisdom?
I'll just throw out there too, if you are a West Virginia resident and you are single, not married, you can prove that you have very low income and you're a full-time student, you can apply for West Virginia Medicaid and you do not have to buy the school insurance. So that is what I have done, and it has saved thousands of dollars just by not having that need. And I've had no problems with it. It's actually the best insurance I've ever had.
Thanks, Kelsey, for letting me know. 2 years.
You're married, so they would look at your husband's income.
I'm married on Sunday. I was single for 2 years.
Oh, yeah.
Yes, Carrie is getting married this weekend, so congratulations, Carrie. Any final questions? Last call.
I'm going to share two real quick. If anyone has children, it's totally doable with children. You can
Just
do
saying.
it. Just saying, you can do it.
Yeah, that is true. You know, I do find that, you know, where there is a will, there is a way. You know, I've heard a recent song from the New Radicals that, of course, you know, you'll hear from me that I catch things a little late, but from the 1990s, the New Radicals had a song called "You Get What You Give." So look it up. It's pretty good. And that would really be the theme for anesthesia school, that, you know, what you put into it is what you're going to get out of it. And your success is completely, you know, up to you. We will give you the tools and we'll be a successful program for you, but you have to do your part to, you know, meet us halfway, and we'll be there for you. So with that, I just want to say thank you for taking time out of your evening. To my current students, you guys have earned a well-deserved break for the next week. We do take scheduled breaks out of the program between Christmas and New Year's, between the spring and summer semester and the summer and fall semester, so that we can have some idea of scheduling, you know, time away. And so they've earned it over this tough summer that we've been through, and I'm looking forward to a week off myself. But look, if there's anything that I could ever, any question that I could answer, Dr. Fraim and I are more than happy to do that. We've left our contact information in the chat. If you want that, you can find it there. We are also available on the DNP Nurse Anesthetist website, and you can find our contact information there as well. So Philip, thank you for putting together this information session, and we look forward to hearing from you in the future. So with that, have a good evening, and thank you very much.
Thank
See ya.
you.